Hi, I'm Ketan from Brightside Dental. Welcome to episode 36 of BSTV. Last week I discussed about the main causes of teeth sensitivity, and this is a very common thing that we see with our patients in the practice, and it is something we see often multiple times on a daily basis. So it is something that affects people a lot. Also, it's to differing levels because some people, they have some level of sensitivity, quite mild, and it doesn't really impact them very much. And then the other extreme is that the sensitivity can be really quite intense, and it really then bothers the patient, and it can impact their day-to-day activities as well. What we do often find is that the weather can have quite an impact as well. So in the winter, when it's very cold, naturally the teeth can feel more sensitive as well. But then the flip side is also in the summer, it can happen because in the really hot weather like we've had quite recently, you're going to want to have cold drinks more, maybe ice cream, things like that, which then can set off sensitivity. So ideally, as a first line, what I would recommend is to seek some dental advice to try and find what the underlying cause of the problem is, because as mentioned last time, there can be quite a number of different causes, and as a result that can impact what will be the best thing to help manage and improve the sensitivity. So in terms of things that can be done, the main things are: one is to try a desensitizing toothpaste, and there are lots of different brands on the market. The most common ones are Sensodyne and Colgate, and they have different types of toothpaste. Now, what you might find is that you might try one, it may not really help or have any impact, and it might be a matter of trying different ones because they have different ingredients and components, and one type might be more beneficial for you. If you are using a desensitizing toothpaste, often is something you need to use on an ongoing basis, because again, something we see from a lot of our patients is they'll use a toothpaste, things are better, so because it's better you forget, start using a normal toothpaste, and then the problem can come back. So if the toothpaste helps, then great, that's the easiest thing to do. There are certain other things that can be done. So in the practice, a simple treatment is fluoride treatment, where we use a high dose of fluoride, which is different to what you have in toothpaste. It's in a gel usually, and that's applied to the teeth, and that can give added protection and reduce sensitivity. Another thing is to use a desensitizing varnish, which is something that's painted onto the surfaces of the teeth where roots can be exposed, and that can help seal over exposed nerve endings, which is what leads to sensitivity. And by doing that, sometimes that can be very effective, and that can be a longer term treatment. Often that could last for 2 or 3 years and work really well. Another thing is one of the big causes of sensitivity is recession of the gums, and sometimes that's due to over vigorous brushing, because naturally we feel the harder we go with the toothbrush, the cleaner the teeth are. However, it can lead to damage in this way. So one thing I would say is it's best not to use a firm toothbrush, either a medium or soft one, if you're using a manual brush with gentle pressure, but definitely do consider changing to a battery-powered brush. They tend to be kinder on the gums, and studies are finding possibly they're a lot more effective with the actual cleaning as well. Now, other things that can be done further to these simple measures is if there are areas of roots exposed or gums have receded, sometimes small fillings can be placed in these areas, and what that does is effectively the filling is taking the place of where the tooth has worn away or where the gum has worn down. It's a simple thing to do. Usually no tooth is taken away for that, and that can also give protection, one, to reduce the sensitivity and reduce the risk of further wear to the tooth, because there's an extra protective layer there. Further treatment, which is a little bit more extreme, not done so commonly, but in the right situations can be very effective, is a surgical treatment called gum grafting. So where the gum has worn down significantly, material can be placed to replace the lost gum, and that can be very effective both to reduce sensitivity and also often for cosmetic reasons as well. If there are underlying problems within a tooth which would need to be identified by your dentist, then it might be a matter of placing a filling, possibly if it's quite advanced or further gone, or the sensitivity just doesn't settle down. It might mean a matter of carrying out root canal treatment. Usually with sensitivity there are ways to help manage it, again depending on what treatment is carried out. Sometimes it's not possible to take it away 100%, but definitely should be possible to get it more manageable on a day-to-day basis. So if you do want any further advice on that, do let us know. We can advise you, arrange an appointment to assess things and recommend the best type of treatment for you. Thanks very much for watching today, and join me next time for more tips and advice on improving and maintaining your oral health along with practice news. Have a great week.